Good afternoon and greetings, everyone. My name is Professor Lamont Edwards, and I'm here to offer an introduction to cultural competence in healthcare organization. I would like to welcome you to DHA 811 for the Virginia University of Lynchburg. This is about healthcare administration for cultural competency. And just as a brief overview, I'd like to give you a brief understanding of what healthcare administration cultural competency is all about. It's about understanding and respecting the diverse values, beliefs, and behaviors of patients and staff, and applying this knowledge to deliver culturally appropriate care and create a welcoming environment for both employees as well as patients alike. Why does this matter? Cultural competence matters because the U.S. patient populations are increasingly diverse. Cultural misunderstandings lead to misdiagnosis, noncompliance, and poor health outcomes. Additionally, competence enhances patient trust, equity, and quality of care. We also will go over our values and attitudes. In doing so, each and every individual in healthcare administration must acknowledge the biases as well as ethnocentrism. We also have to promote self-reflection in healthcare workers. This goes for all tiers of leadership and employment. Embrace cultural humility, not just cultural competence. We must be humble and understand that there are differences amongst all of us. Additionally, we'll offer training tips to use the bias training tools and open dialogue in staff meetings as well as other places of learning and understanding. Cultural knowledge and skills. We'll be reviewing the knowledge, history, language, beliefs, and health practices of patient populations. Additionally, we'll go over the skills for effective cross-cultural communication, use of interpreters, visual aids, and translated materials to help each and every individual to do better with their cultural competence and learning. We will also visit organizational structures and systemic integration. What does it look like while we're hiring diverse staff, creating policy reviews to address access barriers and boundaries, as well as integrating cultural competence into mission statements, quality improvement, and leadership evaluation? We'll also visit some best practices to include community voices in advisory roles. For example, picture a scenario where a Hispanic patient comes in with diabetes and refuses insulin injections due to cultural beliefs. The application that we could use in here would be to use people who can serve as interpreters, access health benefits, offer culturally competent and appropriate alternatives like oral meds first, and then also discussion. What we can do is how would we handle this? I'd like to ask each of you, how do you handle this within your organization if you're leading this type of progress? For conclusion and action steps. In the meantime, we're going to focus on cultural competence that is not a one-time task, but it's always seen as something that's ongoing. We'll also continue to start with individual values, expand to organization-wide reform, invest in training, policy change, and community engagement, and then also utilize an action plan, conduct cultural audits, train leadership and frontline staff, and then review and revise policy as another part of the ongoing process. We've given you a brief introduction. Have a questions for you. Do you have any questions, comments, or concerns? Please share with us at this time.